The shape of the heart is similar to that of an irregular truncated cone, with its base situated on a superior and dorsal position, and extending its apex towards an inferior and anterior area. The base is situated to the right and the apex to the left. Therefore, the major axis of the heart has a triple obliquity, downwards, forwards, and to the left. The heart has two sides externally distinguishable, the anterior or sternocostal and the posterior or diaphragmatic. The so-called acute or right margin of the heart clearly separates both sides on its right side. Nevertheless, both sides continue on the left side, forming the obtuse or left margin. In both sides, near the base of the heart, the atrioventricular or coronary sulcus can clearly be identified. In the anterior side, the atrioventricular sulcus is interrupted by the opening of the pulmonary artery, and behind it by the aorta. These big vessels hide from our view the atriums. 2/3 parts of the anterior side correspond to the right ventricle, and a third part corresponds to the left ventricle. The anterior interventricular sulcus separates the ventricles. This sulcus corresponds in the interior with the interventricular septum. We can see the posterior intraventricular sulcus in the posterior or diaphragmatic side. In this side, the portion corresponding to both ventricles is approximately the same. The apex of the heart is its most inferior area, and it corresponds with the left ventricle. The most superior area of the heart is the base of the heart. It extends backwards and to the right, and it corresponds almost exclusively with the atriums. On its right side there are the openings of the superior and inferior vena cava. The rest of the base corresponds with the left atrium. Between both atriums, the limit is usually depressed, and it corresponds in the interior with the interauricular septum. In the left atrium we can see 4 orifices, 2 on the right and 2 on the left, that are the openings of the pulmonary veins. Between them the left atrium is smooth and is closely related to the esophagus. The cross-section of the heart is the posterobasal area, where the junction of the coronary sulcus and the posterior interventricular sulcus are located. Internally, this area corresponds with the junction of the interauricular septum and the interventricular septum,